mynews.studio.
In the Amazon rainforest, there's a country that was once overwhelmed by malaria, and now it's malaria-free. What did Suriname do differently from others?
Today is July 8th, 2025. Suriname has just become the first country in the Amazon region to be certified malaria-free by the World Health Organization. That's a significant change. For years, malaria was present almost everywhere in Suriname, especially deep in the rainforest and among mobile gold miners.
Right, and if you look at the numbers, they really show the scale of the problem. In the early 2000s, there were some areas with as many as 160 malaria cases per 1,000 people every year. So, what changed? Suriname didn't wait for outside rescue. They adjusted their approach to match the real conditions on the ground.
But reaching those remote, high-risk populations, how did they manage that? Traditional health clinics couldn't really get to everyone, right?
Exactly. Suriname moved malaria control closer to people. They worked with Medische Zending, their primary healthcare service, to train community health workers. These were local people, so they could diagnose and treat malaria early, even in places with no roads. Plus, they created something called malaria service deliverers to reach gold mining camps, which were big hotspots.
That really shows how important local trust is. But I'm wondering, was their focus only on treatment, or did they handle prevention as well?
Prevention played a major role. They distributed insecticide-treated mosquito nets, did indoor residual spraying, and shaped their strategies for specific groups, miners, indigenous communities. And as the risk moved, they shifted their focus too.
There's also the international side. The Global Fund, WHO, PAHO, and the U.S. government provided funding, diagnostics, and technical help. But Suriname also worked with its neighbors, didn't they? How did that make a difference?
Cross-border work was crucial. People often cross between Suriname, Brazil, Guyana, and French Guiana for jobs. By sharing information and coordinating, they reduced the risk of malaria coming back in. And with a national malaria elimination task force, they kept both political and financial commitments strong.
So by 2018, Suriname had its last case of Plasmodium falciparum malaria. By 2021, the last case of Plasmodium vivax. That's 2 major malaria parasites eliminated from local transmission. Then, on June 30th this year, WHO officially certified them malaria-free.
But the job isn't finished. They still need to prevent malaria from being brought in again. That's why their surveillance is so intense. If a case appears, they have to catch it immediately. International partners have promised to help keep this up at least through 2027.
Why does this matter for the rest of the world? Malaria remains one of the deadliest infectious diseases, especially in tropical regions. What Suriname has done proves that even in difficult environments with limited resources, elimination is possible. Does this set an example for other countries fighting malaria?
Yes, it does. With political determination, international collaboration, and community involvement, even a disease that's deeply rooted can be eliminated. The lessons from Suriname, local care, customized prevention, cross-border teamwork, apply not just to malaria, but to other infectious diseases and future outbreaks.
And as climate change and drug resistance make malaria harder to control, Suriname's achievement reminds us that progress is possible. The fight continues, but this is a guide for others.
From a long-standing threat in the Amazon to an example for disease elimination worldwide, Suriname's journey is about persistence and adaptation. Thanks for joining us as we looked at how a small country tackled malaria and succeeded.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.